I first became interested in the problems of health policy in the early 1970s. And at that time, there were proposals for universal health insurance from both Democrats and Republicans. President Nixon had his plans. Senator Kennedy and other Democrats had theirs. And there was an expectation that we were going to reach some bipartisan resolution of this question in the early 1970s. That moment was lost.
One of the points in your book is that it's not just a problem of the political structure, but actually the populace itself, because you call it a policy trap, that there are people that have done very well under the system and don't want things changed, and then there are people that don't.
Yes.
Has the Affordable Care Act changed that dynamic?
Well, it was an effort, and could still be a successful effort if it's upheld, to overcome this trap. So let me explain this idea of a policy trap. The idea is that during the mid-20th century, we enacted a series of partial measures. We have a tax subsidy for employer-based insurance. We have the Medicare and Medicaid programs. We have a separate system for veterans, a variety of other programs, some for particular diseases and so forth. And in that process, we tremendously enriched the healthcare industry. We satisfied a majority of the public. We buried a lot of the costs so that people don't really see them very clearly. And we also gave a lot of people moral arguments as to why they deserved good health care, but other people did not. So the employees have worked for it, the veterans earned it by their service, the elderly earned it through their work years, and a lot of people then feel, why should I pay taxes for these other people who haven't earned it? And that, I think, has helped to create this very unproductive political deadlock that keeps coming back.
You write in your book that the Obama administration felt that there was that the early deliverables, the things that would take effect immediately,
Yes,
would swing the public in favor, and that didn't happen.
No, it clearly has not. Most people, I think, remain very unclear as to how this legislation is going to work in practice. They don't really understand what's in the law, and they're not likely to understand it until we get to 2014 and people can actually say, oh, I get what an exchange is and I see what the alternatives are. But right now, that's likely to remain very foggy in most people's minds. So putting off the implementation of the law, I believe, was a really serious political mistake. And it's one of the things that I wrote about while the debate was going on. I tried to convince a lot of other liberals that the public option was much less important than the timetable. And I didn't get anywhere. But look, there's another problem with the law that I have also been concerned about, and perhaps we can talk about that, and that's the whole question of the individual mandate. Very few people understand the mandate is really a mandate in name only. There's no enforcement behind it. Yes, there's supposed to be a penalty, but actually nothing will happen to you if you don't pay the penalty. There is no provision in the law for the garnishing of wages, for putting a lien on property. There's no criminal penalty. You can't go to jail. In fact, nothing will happen to you if you don't pay the fine. And the hope of people involved in writing the legislation was that, well, Americans are law-abiding. If this is the law, they'll comply with the law. And they point to the fact that in Massachusetts there's a mandate and the penalties are not overwhelming, but there has been high compliance. Massachusetts is a different case. Massachusetts started out with a very high proportion already with health insurance. They didn't have to go that far to achieve a near universal level. In addition, in Massachusetts, you had total backing by business as well as both political parties, Republicans and Democrats. You had ads with the Boston Red Sox on the air saying now is the time you have to get health insurance. This is not the situation in most of the rest of the country, where you have opposition led by the political leadership, where business is not in support of the law. So I don't believe that the mandate would get nearly as high compliance in the way that it's written as the Congressional Budget Office has estimated and many other people have thought. I think the mandate is actually both too strong and too weak.
I want to ask you one final question, which is, Your first book was a lot about doctors and about the political lobby of doctors opposing um, reform a century ago. How's the medical profession now as they implement these potential changes, like capitated payments that they were talking about a century ago?
Medical practice is changing. There are fewer doctors who are in individual solo practice, who have a kind of small business view of the world. Many more are in groups, are on salary. I think that's a major factor changing the profession. Many more women in the medical profession than there were back in the 1930s and 40s. So the character of the profession has changed. I think it's much less opposed to the kinds of programs that reformers have been interested in. There's been a lot of room for agreement.
Great. Well, thanks so much for coming in. We really appreciate it.
Thank you.